All right, so what we're likely dealing with here is not only potentially an AC joint issue, and when we say AC joint, we're talking about the acromioclavicular joint here. So where the acromion, or this part of the scapula, meets the clavicle, and that's where you were really tender, right on that AC joint. So some of those tests that we did right there were to irritate it, and you're really, really tender on that area. So I actually don't think it's the rotator cuff muscles itself, because when I did this muscle and this test and this test and this test, you were like, it's okay, I feel it, but then you felt the pop and the click right at that AC joint. Right. So then I did some AC joint ones, like we're bringing it across and then doing this and then doing this. You're like, yeah. That's really, like, when you bring your arm across, and I'm sure that's when you feel most of the pops and the clicks and the grinding, it's because you're really grinding that AC joint. It's almost like, imagine this hinge here, and you're just like crunching it together. So when you pulled, or the way that thing fell, or you were probably having your arm pulled outward while you tried to pull this in, and it like separated the AC joint a little bit.
That makes sense.
So I don't think you had what we call a full-blown AC joint separation. And so what you will see in like a true AC joint separation is where like this literally will rip right there, and this will glide upwards. And it'll almost look like it's this, and then the AC joint will be separated by a massive gap there.
And you'll be able to tell through movement and everything else.
And sometimes what will happen is, like, as it heals, if you don't heal it properly, even if it does heal, it heals like in a TP, like a tenting position. That's what we call it. We call it tenting. So let's take a look. Some AC joints will heal a little bit more like this.
I
noticed on your left one, you actually have a little bit more of a tenting position. Whereas, like, remember when I went like this on the side and this, you're like, I don't really feel that. So I think all this compensation, as you're right, is starting to wreak havoc a little bit on the neck. One thing that may be an issue, and why you probably find relief with the cracking of the AC joint, is because after you release this, you're actually helping it with some sort of decompression. You're actually increasing the space. That's what an adjustment does.
Right.
One thing I think that you can add to make yourself a lot better, a lot faster, a lot sooner, and why you don't get results with push-ups, is because you're constantly straining the rotator cuff and the AC joint without rehabilitating it. So when you add rehab with this AC joint, with this rotator cuff, because the rotator cuff isn't injured, but the rotator cuff is just a group of muscles. Let's just take a look. So here's the flap of meat, what I call it, the deltoids. We're going to get rid of them. The rotator cuff is a group of 4 muscles that really just kind of secure these areas here, and up there. Well, that's the trap, but that's this one. So when we have the AC joint, we can get the AC joint disruption. We can get a little bit of irritation back here. It could irritate the subacromial bursa. It could irritate a little bit of the posterior aspect of this area, whereas the supraspinatus, I tested that. It's a little bit tender to you, but that could be because of this. One thing I did check out that I don't want to say is very concerning, but that may limit some of your healing as fast as you'd like, is what we call the labrum. So inside, deep within the shoulder joint, you have a labrum, right? And this labrum is a ring of cartilage, right? So if we take a golf ball, right, and we put it on a golf tee, the ball can fall right off the tee very easily. But imagine putting a piece of tape around the base of it. It's going to be much harder for that ball just to fall right over. That's exactly what the labrum does. It's this nice circular ring of cartilage right there that holds that ball and socket into place. And what I did is I tried to push it backwards.
Oh, when you were grabbing it?
When I grabbed it and I was pushing it backwards, you're like, it didn't feel so good. Yeah. And then I put my hand behind it and I pushed into it. You're like, oh, that actually went away. Yeah. That's like what we call like a pivot shift test or a shift test, I should say. And what we're doing is trying to shove that thing backwards to see if it irritates that. And because if it irritates it, it's probably not as 100% stable. Okay. Here's the thing. Labrums, by definition, if you talk to most people, they're not going to actually heal on their own. They may be ripped and torn, and they may stay torn forever. They may heal a little bit. They may not. I have a torn labrum. I have zero problems with my shoulder. What the most important damn thing to do is strengthen the heck out of the rotator cuff, because 90% of the motion, or if not more, through the whole shoulder joint is done by muscles. The most of the stability or strength within that joint comes from the muscles. So that's why the rehab process is going to be really important. Doing those band work where we talk about where you did it easily going inward, but you couldn't do it much going backwards. Like those are some of those things. I would start with just the band going inward, the band going outward. Start with that. Get a good posture going on. You'll start strengthening not only this, but the back part of the shoulder.
Yeah.
It'll align the shoulder joint a lot better, and it'll align the AC joint. So when we do the adjustments, when we do some of the soft tissue work to that area, you're going to actually be saving yourself a lot of time and money instead of having to go to another PT after this. Literally just do it at home, and you're just going to save yourself literally another 3-6 months worth of care. You're strong enough, you're healthy enough, you're fit enough for me to not be worried, whether it's COVID or not, doesn't matter. I'm not worried about it. You're strong enough, healthy enough, fit enough, and motivated enough to do this. I don't think it's an issue. I think it just may take a little bit longer than you expected, because you did have a whole window fall onto you.
Yeah.
I don't know how heavy those things are, but it doesn't matter if
They get pretty heavy.
It doesn't matter if it's 8 pounds. If it's falling 3 feet and you grab 8 pounds.
That whole momentum.
Yeah. And that's what happens. Your body stayed straight because you were on a ladder, right? So you had to stabilize. Your body had to stay, but the shoulder had to go. And that's where you get this like ripping effect. And especially, you didn't grab it here. It grabbed probably going down.
Right. Grabbed it right here.
And which puts a ton of pressure.
Right.
I did test your ligaments, and I did test the stability, meaning the like, is it intact? Is it going to slide out of place? I did test that. No. Everything's good. So if that was a no on my point, meaning like it wasn't stable, I would say, listen, we got a little bit of work to do. If you're not going to get better in like at least a little bit of time, I'm going to refer you out. In this case, you had the stability, not going to worry about it.
Sweet.
So, but as a result, you know that with all the compensation, all the muscles that are attached back here, you're going to get some neck pain and tension that builds up as a result of these muscles having to work so much harder than they need to, and it's going to start translating through here
a lot of time
and through here.
like right in here now.
Yeah, so you're gonna definitely benefit from a whole host of programs and stuff like that, but we'll get you into that too. So,
Sweet.
Any questions on that?
No.
Comments, concerns?
Uh-uh.
Awesome. So let's pull that down, and I can always send